And it looks like we are live on YouTube.
Okay. Good morning, everybody. Welcome to the special council meeting for today. And we'll start the meeting out by calling the meeting to order at 9:12 a.m. And we will do a moment of silence for our invocation.
I did a pipe ceremony this morning too.
Okay, big witch chief. G. McWitch. Next we'll have roll call, Nikki.
Kathy Travers,
Here.
David Morrison Sr.,
Here.
Shane Drift,
Come on, here.
Travis Morrison,
Here.
and Peter Boney.
Here.
Okay, we have a quorum. Everybody's here. Okay, next we'll have approval of the agenda.
Okay, I got a couple of things I gotta move around here. First off, I need to move Danny and David Squidge to in front of George Strong. They have something come up. They have to meet with us right away.
Okay,
And under Joel, I'm gonna remove item C, which is the discussion on the garbage program.
okay,
Then under Deanna Drift, I'm gonna remove items F and G. We're still waiting on DIA, some stuff we gotta get done there, so those ain't ready yet. And then I'm going to add Christine Lundemo with the 22-23 Net Lake Vermilion Head Start Child License. And we'll put that in right after Deanna in front of me.
okay,
And then under me also, I want to add in the dam declaration also. So
okay. Under other, right?
yeah, under other.
Okay,
I do believe that's everything I had.
okay. Thanks, Rob. Any other additions? Or deletions or corrections? Oops. If not, I'll call for a motion to approve the agenda with those additions and corrections. Made by Travis. Is there a second?
Second.
Second by Chief. All in favor signify by saying aye.
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 Opposed, silent, motion carried.
Who
Okay,
seconded? Who seconded that one?
Chief.
Our pager just went off.
Yeah, I'm sorry. There's a fire call. So
Oh,
it's raining.
geez, Travis.
It's an automatic alarm. Someone might have just pulled the alarm. So probably about 10 minutes, I'll be back.
Okay, all right, go.
Okay.
I guess I'll take over. I don't know what I'm doing, but I'll take over. Okay, next we have approval of the meeting minutes, April 6th, 2022.
Maybe that we need to include. Sorry.
Questions on the meeting minutes? For April 6th, 2022. If there's no questions, I'll call for a motion to approve the April 6th, 2022 meeting minutes.
I'll move.
Moved by Chief. Is there a second?
Second.
second by David. All in favor signify by saying aye.
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 Opposed, silent, motion carried. Okay, next we have the consent agenda and it's rather long. So I will read it off. From Mndot team for basket raffles and auctions and RTCE prizes, 400. Sole source to Nelson Colley Electric for health for a new generator for $172,796. That one was 400. Sole source to ConnectWise LLC for a ticketing system for our organization. Sole source to W.A. Fisher to redesign the website for $14,330, 400. Agreement with Whipley for accounting support, that was 400. Contract for lease billboard on Highway 169 with Jim Glowacki for health, 400. Sole source to road machinery supplies for $8,850, 400. Approved FY 2023 Minnesota Head Start application, 400. Tribal Teaching Eminence for K through 12 for Charles Chaz Wagner, 400. Resolution 95 2022 First Amendment to T-Mobile lease, 400. Resolution 96 2022 approving Mndot Agreement with Highway 65 project, 400. Resolution 97 2022 authorizing transportation manager to apply 2022 public transportation on Indian reservations grant, 400. Resolution 98 2022 authorizing transportation manager to apply for FY 2022 low or no emission grant program, 400. Approved consulting agreement and sole source with RT Hawk Housing Alliance for $17,500, 400. Agreement with Hunger Solutions Market Bucks Initiative for 400. Contract agreement with Lamar for billboard in I Falls Highway 53, 400. Use of band logo with alterations from Victim Services ICWA, 400. Agreement with Minnesota Potlatch Purchase First Amendment, 400. Resolution 99 2022 supporting Essentia Health's CDS request, 400. Resolution 100-2022 investment policy and investment committee bylaws, 400. And that is the consent agenda. Any questions on the consent agenda?
Hey, Kath, I did have someone asked about this consent agenda, if it was made, if the public could look at it. And
The agenda itself?
well, no, like say they wanted to look at that resolution 99 2022. They wanted to read it just to look at it. And I said, I believe they can.
Yeah, the resolutions are public.
Yeah. So that was just my question. That was the question that it was
Okay.
asked.
And go ahead, Shane.
I have two questions. One is the for letter D, sole source request for W.A. Fisher, and do they have an idea what they're going to be doing with the new design?
They're working on it right now. They're just it was just first of all getting the agreement in place, and then it's going to be. I think what they're trying to do is design it so it's more user friendly.
Yeah,
Right now it's really difficult to find things, so we'll be working with W.A. Fisher to make it more easier to find. And I know that we've looked at Leech Lake's page for their web page, and something similar, but like user friendly. Yep.
Okay.
Ours is really hard to find things out on.
And the other thing too, that if we could reiterate the approval of the Mndot Agreement regarding the Highway 65 project, just to let members know.
Jeff, can you elaborate on that a little bit?
Sure. Yeah, the Mndot Agreement is basically, it's a short agreement with Mndot that authorizes Mndot to come onto the reservation to conduct the Highway 65 construction work that they'll be doing, the grading and then the repaving work, widening the road and the shoulders a little bit. So the agreement itself is pretty short. It recognizes, Bois Forte sovereignty, right to control entry onto the reservation, and basically the band is authorizing Mndot to come on for the purposes of conducting the project. That's really all this agreement does. There are separate agreements, as council knows, for Taro and other items related to the project, but this one is basically a right of entry agreement to allow Mndot to come on. And I believe that project's still slated for this year.
And then our band members will be able to apply for the various jobs that will be coming up with it, correct?
Right. Yeah. So there's a new pilot project that the band is entering into with Mndot, where Mndot's going to provide some additional funding for to incentivize the contractor, the construction company, to hire band members, to train band members, to have band members be working on the project. Yep. So in addition to the Taro fee, which the state will pay, there's also agreements with the state to provide funding for hiring band members for the project itself too.
I guess, go ahead. I guess I would kind of strongly suggest that people contact Warren Vilburn with the Taro program to get their Taro applications in, because that's probably, I'm not sure, but I would just say get a Taro application in for this project, and we'll get more information out on it, because I don't see any information coming out on this Highway 65 project from Taro. I don't see any posters or anything, so we really need to get on that to get people to apply to, because there will be some labor jobs, that type of thing. So does that answer your questions, Shane?
Yep.
Okay.
Hey, Kath.
Yeah.
Do we know for sure when the project's gonna start? I mean, I heard in June, but.
Well, that's what
haven't
Joel's
really
on the
heard a
agenda for.
final date yet.
We can ask Joel when he gets on.
Okay.
Okay, do we have a motion to approve the consent agenda?
Move.
Second.
Moved by Travis. Chief. Jeez. Seconded by Shane. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Sorry about that, Trav. I saw him going. Okay, next we have Danny Paradas and David Morrison Jr. with the Seeding Cultural Treasures Grant application from the Bois Forte Sovereignty Group.
Oh, do we admit them there? Chairwoman?
No, Nikki's got him there.
Oh.
Who's you?
Bonjour, good morning, everybody.
Good morning, Danny. Good morning, Dave.
Hey, Migwash for moving us.
Good morning.
Migwash for moving us closer to the between 9 a.m. and 10 a.m. time. So we are here to present on the SCT, or Seeding Cultural Treasures Grant opportunity. So miigwech to squidge for also partnering with our Bois Forte Food Sovereignty Group. We were talking about just kind of briefly, we have a lot of opportunity for traditional Ojibwe food harvesting activities where we could then get our foods to our people. But sometimes on the engagement side of getting our community members to participate and to, learn our food ways, sometimes that can be lacking. And so with this grant, one of the things we'd like to do is staff a person just dedicated to seasonal Ojibwe food harvest and processing education, and promote that within the community so that more members are accessing the wonderful work that the RTG already does with its food programs. I know Squidge has put on netting clinics, and we do have a lot of foods coming to us through the food shelf, but those are Red Lake Nation foods. And what a great model there. So the second part of the grant, we'd like to contract with a professional consultant to study and develop an actionable business plan for a small food processing cooperative that could feed our people as just regular members, but then really getting our foods into our community meal programs like Elder Nutrition, Boys and Girls Club, and Food Shell, and then also in our kind of food access retail or food service venues that we have at the C-stores, and then also at Fortune Bay and all its restaurants. So we're not trying to like get all of the other foods out. This is just so we have those foods available to us when we want them, and to make it easier at Boysport. So we're calling this project Full Circle Foods. And the hope is that with the staffing under Squidge, who already has, amazing respect in the community for how he carries himself and is willing to bring people in and is very knowledgeable, that type of engagement will be successful in building the demand for the foods, and then also the education. And all of this, of course, coming around to help heal our bodies and our spirits with revitalizing our Ojibwe life ways, that it'll be a daily experience for more people once again. So with that, Doris has agreed to submit the grant application on our behalf. So we're hoping that the tribal government will submit a letter of support. The grant is due in 2 days, and we'll be asking for 100,000. 46,800 will staff a person with Squidge for 3 years at 15 hours per week, 52 weeks in a year. The rest of the funds will go towards hiring the consultant to work with this project as it grows towards a small cooperative. So we'd have about 53,200 to afford their work over the course of 3 years. And I did ask them about the indirect cost, and they're willing to write a letter that program funds will go directly to the staff hire and the consultant and not towards indirect costs. So that is something for the council to consider in terms of capacity, but noting that the Boysport Food Sovereignty Group will be here to assist whenever is needed to make sure this is a success.
I really think this is a great idea, and I appreciate you guys working on this, because I'm looking at the activities, and you've got seasonal food harvest, like fall is of course wild rice, but it's got harvesting, processing, and cooking. Winter season is rabbit snaring, processing. Spring is fishing, home gardening. Summer is plant foraging, berry, and ramps picking, processing, cooking, home gardening. It's awesome to have this food sovereignty, and you guys working on it like this is bringing a lot to the communities, because like with Net Lake, we're isolated, and Vermilion is not so isolated, but we really haven't been doing anything really much with regards to food sovereignty. You guys have taken this and run with it, and it's really awesome. I really appreciate that.
Great.
If there's one thing that I'd like to, talk about too for discussion, maybe it's just a beginning point to address some stuff that's going on. So I know with some of our stuff that we've been doing, like the netting, we've been trying to do the wild rice for our elders feeding program for the ENP. And then we'll be extending it to like snaring and deer. And I know Ryan from the school has been doing a lot of stuff too with the kids. So we've been incorporating that with the kids as well. So I know that's really good stuff. There are the traditional healing program too has been, we got an event going on this Friday, foraging, and they're bringing a lady up, Hope Flanagan, who's very knowledgeable, willing to share her knowledge and identifying plants and stuff. But some of the issues that we've been noticing is, a lack of participation from community members, staff members, tribal leaders, some of our directors. I know some of you guys been there, like Pete, Shane, and Dave. I know I've seen you guys at some of our events, But, it's just really hard, when the participation is really low.
Mhm.
And that's something we've been kind of collaborating with the programs that have been going on. How do we get more people to want to do Indian stuff, and it's just something, to think about. Maybe that's something you guys could help us address, and a lot of the stuff I send out surveys, what can we do better, or how can I better myself? What could be offered? And some of the stuff I've been seeing as incentives. I know some of the programs, is not allowed to give out incentives just, because of the guidelines of the grant and whatnot. So that's just something to think about. Like this past one we just had was our spring gathering, our Ziguana K spring gathering, where Terry Goodsky came up and we were doing some hoping to teach people that wanted to learn like the grand entry songs. And I was fortunate that we were able to do it with the Boys and Girls Club. Otherwise, probably nobody would have showed up. We had it in Net Lake on Saturday, just Shane showed up. So it's really, but all we could do is keep trying, can't give up on that. We got to keep plugging away. And if we could get, that's what Terry said, if you get one kid to show up, and Shane showed up. So we're happy with that. We were able to sing some songs and it felt good. And, I know they had their family gathering, and some of the people that were up from otherwise, they said it felt really good to hear the drum going while they were doing their family get together.
Mhm.
So like I said, that's just something within the programs that we're seeing as really struggling. Like our walks are really participated well. Our community sporting community events are participated really well. But it's like when we do the culture stuff, it's really and our participation is not the greatest. So our goal is to get more people actively involved, all the way from leaders all the way down to the kids,
Mhm.
elders and whatnot. So that's just something to think about. Some of the things that the programs are struggling with, and like I think this is a really good program too. And if we could provide our community with some of our traditional foods is going to be good. It might be and programs do take a while to take off, and it does take community to come together and make this successful. So I'm glad Danny and the stuff that her colleagues
Yep.
have been doing is really good stuff too. So Mio, that's all I got. And go ahead.
Squidge, I agree. I know that I was at I was at a conference, and this is when Sober Squad was first starting, and the young man that started Sober Squad initially said that eventually he was the only one showing up. He would put these things out to the community, and he was the only one showing up. But pretty soon, one person came, two people came. It goes by word of mouth. But I have a suggestion. I think that because a lot of people aren't on social media, a lot of people, I'm going to say elders myself, I don't really go on social media. Maybe do door-to-door flyers within the community. We usually have on Thursdays with the Emergency Response Committee, we would be doing flyers door to door, but maybe some of the kids would see them and adults. And I think that our way of communicating is too much relying on social media and stuff, where people are used to seeing a paper posting or things like that. Like I mentioned with the tarot, we've got to start getting information out within the community. So maybe door-to-door flyers, just sticking them on the door, sticking them in the mailboxes, that people have rural routes for. That might be an idea to get people going, but keep going. Like I said, that guy with the Sober Squad said it took many, many weeks or even months for the people to start showing up. But don't worry, Squidge. And I know it's frustrating, but it will happen. It will happen.
I think to add on to that too, they could also maybe send notices home with the kids from the elementary school, and then maybe have the radio station, KBFT, maybe mention it on some of their shows, radio shows, hey, come to this event, and then kind of give out your guys' schedule. I was going to add on to that, appreciate what you guys are doing.
Yeah.
Squidgy and Danny, with the foods and stuff like that, it would be good to know, people to know what our people used to use. They used to use they call it swamp tea. They used to, it's used for it's used for kind of like similar to Pepto-Bismol. When somebody has upset stomach, they go in and grab that plant from the swamps and mix that in with their tea. And one of the stories that my grandma shared with me was that a long time ago, the Eskimos were down this way, from way up where they're at. They came all the way down this way and kidnapped one of our band members and took her all the way back up where they were from. Well, she escaped from them and came all the way back. What do you think she used to survive to get back home? The traditional foods. And years later, finding out that was actually Donald Chosa's one of his relatives. And so that basically just showed that the story was true. What my grandma shared with me, and then what Donald and them had on their side of the family, and it's everything just like connected. It's like, wow. So and then the stories of when the young boy escaped from the boarding school on the Vermilion side, and he went to his relatives over in Lac LaCroix. Well, he ate traditional foods along the way to get back home. And just stuff like that that'd be good to share.
Yep.
Yeah, that's good stuff too. Yeah, and like I said, some of the ways that we do send out, I know we do usually use KBFT as a plug. We usually do hit up the social media sites and we send out a mass email, but maybe that's something we could do too, is use the text and the calling system as well. Maybe that's a possibility.
Oh, good idea. Yep.
And we haven't used that yet, but I was just thinking that was just more or less for emergency stuff or whatnot, but that would be a good way to get out too. Otherwise, we could have Shane and Pete send out their smoke signals.
There you go.
I'd be worried about that.
I'm excited for this, to get a staff on to do some of the stuff that we've been doing. It's good, and I know some of the racing time, I know some of the same kids that participate look forward to doing that, and I know the elders, they kind of ran out of rice this year, and we didn't get them as much rice this year because they didn't use what we got them last year. So the first year we did that, we got them 100 pounds. Then this year we just gave them 50. So I know another thing too is we usually try to have the kids go out and get the rice for our elderly nutrition programs, but it's been a struggle to get kids from Vermilion to go out and do it. And I'd like to use the Net Lake kids, but I feel the Vermilion kids could take it upon themselves too to go out and get that for the ENP over there. But I guess just doing it for both places is what we got to start doing, no matter who does it. If it's kids from here, if it's kids from Vermilion, we just got to make sure that they should be getting that rice, and the ENP should be eating rice at least once a week rather than sparse. So
I know that I think it was Terry Morrison was asking for fish for the elders program during the netting season, if anybody be willing to donate any walleyes, because a lot of our elders like that walleye, and I think that we as community members need to start kind of getting back to our traditional ways of sharing,
right.
Because we don't do that anymore.
And also like Jenny Woodenfrog and John, they used to like the suckers.
Oh yeah.
My grandpa Bill Day, he used to like the northern. So there are elders that out there like that different fish. So this year the ice went out late and we were able to go out this year. So we weren't able to do that with the kids this year because that last week, doing some things prior, so I wasn't able to get out there this year, which was kind of unfortunate, but we won't take no more of your time. I know you guys got a busy schedule, and I appreciate Danny for really pushing this and willing to collaborate, include me in this, and I'm excited for it. So
yes, very good.
I would like to add, I think it's good you guys are doing this. I would like to add consistency to that. I know like the Porter girls, Monica and Curie started a game night up at the center there, and they were kickball and stuff like that. And it took a while for it to get off the ground, but it was going really good. And then all of a sudden COVID hit. Now we haven't had it for quite a while, but that consistency, them girls showing up every week, just their family sometimes, and it took a while. It was awesome when it was going, go down there and watch kids and play and see them down there. The other one I was going to mention was squidges that we should start. And I wanted to do it this year with fishing, but things just didn't work out for us. I wanted to do some video recording and showing from start to finish the process, so that we could have it for not only for us for the band, but for like a teaching thing in school.
Yeah.
A class in school. Maybe it's once a year, maybe it's twice a year. Just giving them our culture and our language and our way of life, and to not only for band members, but for non-band members alike, to get an understanding of the Voice for It band, where we're at, who we are. But anyway, miigwech to you and Danny for.
Yeah.
Miigwech
Really good.
everyone. And what's really nice with this program, so it's run through Propel Nonprofits. And so it's seeding cultural treasures. The thing is, they're trying to build up capacity for BIPOC arts and culture. And there's kind of group learning, peer-to-peer opportunities, optional for those, with these, we're facing, I think, similar issues as other communities too, especially with COVID, when we all got so disconnected. And with, Squidge's experience already and knowing what's working in the community for getting the word out, and then brainstorming other ways with folks, they'll have, maybe insights from other communities that can kind of support, what direction to go to really get people interested. And I think it'll be really exciting to see, the next few years, what's going to get people to come and be together again to do these things. So chi miigwech, everybody.
Chi miigwech. Do we have a motion to approve a letter?
Kath, I had a question.
Oh, go ahead, Dave.
I know that I lost my agenda stuff, and I had a heck of a time finding it back up. And when Squidge and Danny were talking there, and I was trying to find it so I could see what they were talking about. But anyway, especially with the high cost of foods going up.
Yes.
Food that are at the grocery markets, and so this by doing this, it's going to help people to go back to the using wild rice, rabbits, fish, berries, and things like that. So I think this is a very good program, and I know that they'd be it's going to be benefit band members. But if we're having trouble with getting kids there, I think maybe one of the things we could do is probably if we could utilize the Boys and Girls Club vans to go up and pick some of the kids up out in housing, and bring those kids up, and so they'd be able to participate. And so I know that's what at the Baptist church up there, they have a little van that they utilize when they have an activity or something up there, and they'll go pick the kids up and bring them up for a couple hours, and then after the activity is done, they take them back home and make sure that they get home okay. But something like that we could utilize the Boys and Girls Club band to allow people to go pick those kids up and make sure they get back home safely, so they could participate in this program or the programs. And I think it's a good idea what's going on, what we're going to go after, what they're going to go after. And so I think maybe I'd like to see us go forward with this, and put out something where our elders and could come out and help participate with our young kids and show them how to prepare foods, because like the wild rice, how many of them know how to pop wild rice actually, and the way it's prepared, using wild rice or popping wild rice. And, but there's so many uses of wild rice that, that you can use. And, but again, I'm very happy that I'm excited about seeing this project coming forward. So
Good. Thanks, Dave.
I'm done.
Okay. Do we have a motion to approve a letter of support for the Seeing Cultural Treasures grant application?
Move.
Oh, who did that one?
Move.
Second.
Moved by Shane, seconded by Pete. All in favor signify by saying aye.
Aye.
Hi,
Opposed, silent, motion carried. Yay.
everyone.
Yes, thanks, guys. Keep up the
Hi
great work.
hi to Jeff and hi to Nikki. Hey, how's it going, Jeff?
Miigwech.
It's out in the
Hey, Danny.
woods.
Hi, bonjour, miigwech.
Miigwech,
I'm sitting
guys.
out in the woods.
And I will send the template letter over to Nikki and Robbie.
Thank you.
Miigwech.
Okay.
Thank
Have a good day, guys.
Miigwech. Thank you, everybody. Gigawabaman.
Thank you.
Gigo up, man.
You man.
Okay. Next we have George Strong. Hey, George, you're muted.
Here I am. Better?
Hi, Anin Boujou.
Bonjour.
Okay, we have you with the agreement for Native Voice One Radio Network, your annual agreement.
No changes to it. It's pretty much the same as last year. Just gotta get your guys' approval. It's over the threshold, so.
Okay, and that is, of course, in the budget as always,
Yep,
and it's $6,700.
correct.
Okay, any questions for George on the agreement? If not, I'll call for a motion to approve the agreement, the annual renewal agreement.
Move.
Second.
Moved by Shane, seconded by Pete. All in favor signify by saying aye.
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 Opposed, silent, motion carried. Okay, next you have a billboard.
Oh, a billboard, yeah.
Billboard
that's the
lease
one that-
agreement.
Yeah, that's just north of Cook. There's no
Okay.
changes in it. There's a $400 charge just to change the design. So
Oh,
that
okay.
was included. But other than that, it's the same rate, just a renewal.
Okay. Any questions for George on the renewal of the billboard lease agreement? If not, I'll call for a motion to approve that.
Move.
Moved by Travis. Is there a second?
Second. Oh, go ahead.
Second.
Oh, second by Dave. Come on, guys, cut it out. All in favor signify by saying aye.
Hi.
Aye.
Opposed, silent, motion carried. Good job, George.
Thank you, George.
Thank
Miigwech.
Yep, thanks.
Okay, next we have Mr. Joel Astleford, Public Works Director. Good morning, Joel. Minugajib.
Okay, good morning. The first thing I have is, when we had a mineral gravel study done in 2014, they identified different future gravel pits. One of those is across Highway 65 from the Sucker Trail pit right now. So what that footprint has been logged, the environmental's been done, and the TIPO's been done because Lance had it logged a couple years ago. I did meet with Lance. We went over everything. What we would like to do is open that pit up because Sucker Trail is pretty much at the bottom of the floor as far as getting more gravel. And while we do that, we want to enter into an agreement. I'll have to get together with Jeff, but we want to sell gravel to the award winner for the Highway 65 project at $2 a yard.
Okay,
And we could be using up, anywhere between 55 to 75 or 80,000 yards.
okay, that poses a question that came up earlier, Joel. Do you know when that Highway 65 project will be started?
The bids are due June 3rd, so it'll be,
Okay.
my guess is people will want to get going on it right away, whoever wins the bid. I'm guessing end of June to
Okay.
beginning of July.
Okay,
And it is a 41-mile project. It's a long project.
wow,
And every day that they're on the reservation, I will be there monitoring it. So,
okay, good.
The question I have is that, where you want to, dig for the gravel pit, it's not in the land that the tribe is going to be buying back, right? That 28,000 plus acres.
no, it's already ours.
Okay. Try to make sure. Thank you.
Yep, you bet.
Sounds good to me. Any
Hey,
other
Joel,
questions? for
Joel.
Go ahead, Dave.
I had a question, at $2 per yard, is that pretty much standard, the standard rate? Or?
Yeah, it's anywhere from $1.75 to like $2.25 right now. And you don't want to go too high because then they'll go somewhere else and get it.
Okay.
And what I plan to do is to incorporate some of that money into the price of them making us more gravel in that pit. And any extra money will come back to the tribe.
Okay,
Well, the question would be then, what's the percentage of that pit that, that we're gonna sell them? I mean, how big is the pit? I mean, kind of an estimate close, I don't expect to say by the rock, but.
Yeah, for the Highway 65 project, I mean, you might use maybe 2-3 acres. And it all depends how deep you go, because your footprint's also wide, but mostly deep in a pit. So we've done a lot of test holes. I think every company that's bid on that project has done test holes there. And it'll all depend on how deep they go, really.
Okay, thank you.
Yep.
good.
Hey, Joel, how many miles did you say they're gonna do? 45 or something like that?
41.
41, okay.
That's a long ways.
Yeah, it's a big project.
Good.
But, where's it gonna start at and then end at? Is it?
Well, I'm not sure the exact endpoint, but you know where they left off going to Little Fork when they repaved that?
Okay,
It'll start at that position where they left off a couple of years ago,
okay.
and they'll go 41 miles south. So,
Nice.
yeah.
Okay, any other issues or questions for Joel with the discussion on opening a new gravel pit? We have a motion to approve the opening of that new gravel pit across from Sucker Trail.
Move.
Oh, moved by Dave, second by Chief.
Yes, ma'am.
All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Okay, Joel, we have award bid of Tibbetts Trail and approve the contract.
Yep. I sent out bids to quite a few contractors for the reconstruction of Tibbetts Trail. The only people that responded, it was a sealed bid, was KGM. So they're in line with their price. So we want to award them the bid, and Jeff has drafted up a contract. I just need to add some dates in there of when the start and finish will be and the length of time they need to do it. And then we can have them sign the contract if they agree to it.
Okay, is there taro fees attached to this? Oh yeah, 4% taro.
Yeah, it doesn't show in the line items because they incorporated it with the mobilization.
Okay,
And a lot of people are doing that now.
okay, is there a possibility again of our tribal members being hired to help with this? Because I see that it's for curb work
Yep, there's always KGM's very good about that.
Okay,
And that's something that Warren will have to contact them about.
okay. And then what are you looking at for a start date on this, Joel?
Well, they're thinking sometime in July, but I'm gonna, on the contract, I'm gonna put June 1st till September 15th, just so there's a, you never know with the weather or whatever.
Yeah, okay. Okay. Any questions for Joel? No? Okay. Do we have a motion to approve the bid award of Tibbetts Trail and contract with KGM?
Oh,
Moved by Chief?
Travis.
Who was that? Travis?
Travis.
Jesus, man.
Second,
Second by Shane. All in favor signify by saying aye.
Needs a hearing aid.
Yeah, I guess so. Opposed? Silent? Motion carried. Sorry, guys. Good job, Joel.
Damn it.
Thank you.
Thank you. Have a good day.
Be good, Joe.
Oh my goodness. You guys are starting to sound alike. Okay, next we have Melissa Walls, Sean Allen, and Pam Hughes. Resolution number 100-2022. Authorizing Dr. Walls and Palombi to implement public health vending machines.
Hey, we're here.
Good morning. Oh, hi.
Hi, everyone.
Good morning.
Good morning. Pam's got her green hat on today.
Yeah, Pam's got her green hat on today.
Green for mental health.
Yes, that's right.
Oh,
Yep.
Nikki has on green too.
Oh, well, I missed.
Oh, yeah, she does. Doggone it. Okay, anyway. Good morning.
Good morning. Nice to see you all.
Nice
Hope
to
you're
see you.
healthy and good. Hanging in there during this pandemic. We do have a presentation.
Okay.
Can you all see that?
Yes, we can. Thank you.
Yep. So this is interesting. This is an interesting proposal for a resolution that we're happy to come back and answer more questions. I think it might spark a lot of conversation. We have a very brief PowerPoint here just to kind of walk you through what we're talking about. So I'll dive in. So a little background, I think you all probably remember or know that I'm involved with quite a few projects in the community.
Yep.
One is this SIBAR project. That's an acronym for the funding, but it's about injection drug use, and we're starting the data collection this summer. COVID obviously has delayed things a lot. You can see our Community Research Council members for that project on the screen. Then there's this other group that Pam's really deeply involved with. I work with them too. They're funded by HRSA with Laura Palombi from the University of Minnesota College of Pharmacy involved. I think council's met with her about MAT and other issues related to opioids. So in all of these projects, the issues of fentanyl and overdose and these things that keep coming up, including increases in methamphetamine, have been talked about a lot. And one recent innovation in public health is this idea of public health vending machines. So in the state of Minnesota right now, I think there's only one other tribe thinking about doing this that I'm aware of, and that's the White Earth Nation. And Sean and I, who you'll meet in a second, have talked to them about it. But they're not at the point of a resolution yet. They're just having conversations. And then the Native American Community Clinic in Minneapolis is also considering this, but I don't think any other Indigenous communities are leading the way so far. So we did draft a resolution to support implementing one of these. Again, we're happy to have more conversations about it because, like I said, it'll spark a lot of information or questions, I think. One thing that we would love feedback and conversation on is where to put the vending machine. We've talked about maybe at the casino, but as you learn more about these vending machines, you may have different ideas. So I want to introduce you to an expert in public health vending machines. It's my colleague from Johns Hopkins University. He's a Southerner in origins, but his accent is toned down probably from being in Baltimore. So I'm teasing you, Sean, but this is Dr. Sean Allen, and he's just going to share a couple of slides. And Sean, you can tell me to advance the slides for you.
Hi, everyone. Great to be here today. I am originally from Kentucky, but Melissa is right. I've been out of the state for about 10 years now. But I suppose I want to just weaken the language a little bit. I don't know if I'm quite a full expert on public health vending machines. I have been doing some research on them, but I found that there's a learning curve, and I'm probably still on it a little bit. But public health vending machines, they're an evidence-based tool for mitigating health consequences of substance use. They're not new to public health. They were first implemented in 1987 in Denmark, and they've subsequently been implemented in more than 14 countries, including the United States, although they are a relatively new innovation in the United States, and I'll talk more about that later on. But in terms of what they are, they're basically along the lines of a snack vending machine, only instead of snacks, they have anything from first aid kits, hygiene kits, pregnancy tests, naloxone, sterile injection equipment, information about substance use treatment, fentanyl test strips. And really what goes in the machine, it depends on the context and what people need and what the community wants. So it's sort of a choose your own adventure of what goes inside the machine. So what do they look like? Public health vending machines, they can be branded with agency logos, or they can just look like a regular snack vending machine that you would find sort of in the basement of a building or, pretty much anywhere. So these are two images from an organization called Track B Exchange that operates in Southern Nevada. They were the first ones to implement public health vending machines in the United States. So what do we know about their impact? They have been shown to increase access to sterile injection equipment and reduce syringe sharing behaviors. Obviously, if you reduce syringe sharing behaviors, then you lower community level risk for HIV and viral hepatitis outbreaks. Public health vending machines, they're also especially effective for reaching people who may not feel comfortable going to other venues in person, because they can just walk up to a vending machine and it's relatively anonymous and they don't have to disclose who they are necessarily. And they also do provide access to health promoting supplies in ways that lower risk for COVID-19 exposure, again, just because you're walking up to a machine rather than having a face-to-face conversation. So how do they work? It's, again, sort of a choose your own adventure. So they can function anonymously, just like a regular standard vending machine. Walk up, input the code, and you get a vend of whatever the supply is that you want. Alternatively, you can buy a vending machine and embed a registration process so that people have to register, get a unique ID or a card of sorts to scan to access the supplies. I would caution, though, that you want the services to be as low threshold as possible, just to avoid stigma and people being concerned about people finding out that they need supplies indicating drug use. You can also use software to track what supplies are being dispensed. That does require internet access. The value of using the software is that you can log in remotely and know what you need to restock the machine with, rather than having all of the supplies in your car and go to each vending machine. Machines can also be programmed so that some supplies require a registration process. Other supplies can be programmed that they can be dispensed immediately without a registration process. This is something to think about in the context of overdose. We would not want to withhold naloxone if someone was overdosing. We would want them to get immediate access to that. So that is something to consider. Several types of supplies can be packaged together in a box or bag. With extreme weather, machines should be located inside. In Minnesota, that is definitely a consideration. I would definitely lobby to have them inside. And the software can also be used to limit the number of items dispensed to an individual. That's just so that if one person goes up to the machine, they won't empty out the entirety of the machine. So public health vending machines in Clark County, Nevada. I've been working with the Southern Nevada Health District and Track B Exchange, the nonprofit that launched public health vending machines, and we wanted to understand whether or not their naloxone dispensation at these vending machines resulted in any public health gains, in this case, averting overdose fatalities. So in March 2019, they launched naloxone dispensation at their vending machines, and we built a model, and it's under review for publication now, but the findings were pretty stark. And during the 12 months immediately following naloxone dispensation, our model forecasted 270 estimated opioid-involved overdose fatalities, but death certificate data indicated that only 229 actually occurred during that time. So that suggested an aversion of 41 overdose fatalities. So I would lobby and argue that they are effective for preventing overdose. They are definitely not a silver bullet, but they are another tool in the toolbox to preventing overdose.
Okay, I think this is back to me. So some of the conversations we've been having with the community research team who works in the substance use area and with Pam's group is like, if you wanted a machine up at Boys Fort, what would you want to put in it? And Sean already mentioned some of the commonly used items. I added a few more here. You could even put COVID-19 test kits in them.
Mhm.
I'm really curious about, like, could we indigenize the content a little bit? Like, I've worked with an elder Obazon, Lee Staples from Mille Lacs, who allowed us to print some of his teachings on cards during COVID around, I heard mention of swamp tea, like how to make swamp tea. He helped us to put some lessons about offering tobacco for anxiety and stress relief. So things like that could also be in there. Again, this could be a much bigger conversation, but I think there's a lot of logistics to think through. So the reason Laura Palumbi and the University of Minnesota are listed on this PowerPoint is because her grant, the HRSA grant, has some funding that could pay for a vending machine. And then we have some access to funds through Hopkins that could also supplement that funding, we think. Pam's team has already agreed to be the local workforce to stock the machine and get the supplies. And then we could collectively just kind of track and report back to you what's going on, what are we hearing, what are the lessons learned, if that's of value. So that's really all we had for formal presentation. Pam, did you want to add anything that I might have missed?
I was just going to mention something because I know Kathy, when they were speaking earlier about getting information out and going door to door. I attended an opioid meeting yesterday that had Indian Health Service people, SAMHSA people, Center for Disease individuals, and they were saying, and what made me think of it when Kathy had said door to door, that they, some places are now using like a sticker on households, and where that sticker signifies that household has Narcan available. So, you know, that, I mean, I'm really all for these public vending machines. I know currently there are a couple individuals on the Net Lake side and a couple over here on the Vermilion side where individuals know they can get the Narcan and also the testing strips to test their drugs for fentanyl. But I think this is just a much better way for individuals to access. So, yeah.
I'm very excited about this because I think it's a way for people to access things that they would not normally get somewhere else, that, you know what I mean? Myself, if I was, and I was just looking at the pregnancy test, which I can't have kids anymore anyway, but as a young person, I would feel funny going to the clinic or, you know, or anywhere else trying to get a pregnancy test, or go even into the store and buy one where people look at you, you know what I mean? Where a vending machine, I think, is an awesome way to get this stuff out. And I love the cultural component about it. Melissa, that you mentioned. I have a couple questions. How much is a vending machine?
It's a great question, and it depends. A basic machine might run around $2,000 with the technology. If you want more of the data tracking, they can be as much as $10,000, but it really depends on what kind you're looking at, and some are even temperature controlled. That carries additional cost. And I will also say that Some people that I know who are implementing these, they have had a lot of delays in getting their machines once they're ordered just because of COVID.
Right. Now, the other question I have is, it mentioned about registering. And myself personally, I would see that as a deterrent because I would feel that they're tracking me. They're going to let law enforcement know. They're going to come pick me up if I try to access that machine. But I see the part about for stocking and the software for making sure it doesn't run out. I really like that part. I guess I would like to see, and I don't know about the other council members because I just jumped in here right away. I would like to see these vending machines in Nett Lake and Vermilion, actually more than one. So that's just my viewpoint on it. I think it's awesome. I think it's a way for our people to get access to things that they probably either maybe don't know where to get it, don't want to go and be seen about getting it, that type of thing. So I'll be quiet and let the other council members talk.
Hi, this is Shane. A couple of questions. First of all, do you have an idea where you're thinking of putting the machines aside from the casino? Where else?
Pam, do you want to answer that one?
So I know there, a couple had mentioned on the Nett Lake side, possibly the C-store, maybe like in that laundromat side where there's not a lot of traffic coming in and out. And I thought there was mention too of the tribal government center, maybe more, like that hallway where the back of the bank is and the washrooms and stuff, so that people aren't seeing who's at them.
Right.
And on the Vermilion side, just a casino?
That's what we had talked about, Shane, only because, the social center, because we, brought up New Moon. There's not access to those buildings 24 hours a day.
Now, my other question too is a concern with, I understand where you're coming from with the sterile injection kit things, but on the flip side, that is that when somebody uses, they're gonna throw the needle somewhere, and sometimes they end up on the ground somewhere where the kids are playing. So that's a kind of concern for me, because I know that we had that a couple of years ago on the Vermilion side, I do believe it was, where some kids were finding the dirty syringes around the playground area. And, with these vending machines selling these sterile injection kits, is that just going to perpetuate the problem? Where a kid could pick up a dirty syringe and not know, stab themselves. Well, that's a concern.
Thanks, Shane. Yeah, Sham is an expert in that area, so I'm going to ask him to talk a little bit about that.
Yeah, I fully understand the concern. I think, I would start by saying they're public health vending machines, not necessarily a syringe vending machine. So, if we're not comfortable necessarily putting syringes in there, then we can put other stuff. I think that's a very valid discussion of what goes in the machine. But there's really no evidence that it encourages or otherwise enables substance use. But in terms of the syringe disposal, that might be a discussion where we could put sharps containers in the machine so that if there are sterile supplies in there, then you can currently receive a sharps container so that you have a safe space to dispose of your syringes. That's actually being done in Clark County, Nevada. They have sharps containers that go in their machines. So there are ways that we can think through that, but I fully understand the concern.
Okay, and now my last question is, you talked about the fentanyl strips. Now, is that basically where if they buy something, they can test it for fentanyl and make sure it doesn't have it, correct? Then I think, yes, I would be in total of support of doing that, because I'd hate to see any of my band members take something without testing it first and having it end up being fentanyl in there. So I'd be in favor of doing that.
Yeah, and I will just add that the fentanyl test strips, they'll tell you yes or no for fentanyl, but they won't tell you how much, but it is still an effective strategy for reducing overdose.
I just had a comment on the sharps thing. I think maybe if you put the syringes in there in the vending machine itself, maybe put a sharps container near the vending machine. If they're willing to come get it there, maybe they'll be willing to bring it back and put it in the sharps. You know, it's just a thought, but it's, or else we can put more containers out in the public.
Yeah, and that can be something that we explore as part of the funding as well, of pairing a syringe disposal box with the vending machine itself. I don't have any opposition to that, Melissa. What do you think?
Well, even if it's just nearby it just doesn't have to be on the machine itself.
I just see this as a huge benefit for the communities. I can't understand why this hasn't gone through like a wave of vending machines out there. I mean, it's a way for people to access things that they normally couldn't access unless they know who to go to get them. You know what I mean? And so this is a no-brainer for me. I mean, I would love to see Boys Fort do it.
And we've had other tribal leaders from other reservations asking us what we do. And realistically, our drug problem ain't as bad as it is at other reservations. And we're kind of like, oh, we don't have that yet. And then, but they tell us all the stuff that they're going through. And us as leaders, because they usually come up to me and Kathy, and they'll tell us this different stuff. And it's scary. You know, we're kind of like, oh, what are we going to do when that comes here? We're not sure what to do, but things like this are like a step in the right direction to try to curb the problem, but give the users a chance of being safe anyway.
And we know that, you know, these drugs and everything are here. Like right now, we have a big concern, and we'll be putting out a notice. I asked Pam for some information this morning, because we've had overdoses with fentanyl that's come into our communities within the past few weeks. And we need to let our communities know, our users and our families, it's there and what to do. Which, thank you, Pam, for that this morning. But anyway, it is here, and you know, the more we can do, and a lot of people will view it as, oh, you're just helping them with their habit, but no, you're preventing them from dying. You're preventing them from whatever. And if there's access to services on there for treatment, or if there's traditional things on there, it's another way for people to access services without actually seeing somebody. You know what I mean? So go ahead, Pam, you were going to say something.
Well, I was just going to say, when Trav was talking, that, you know, when you hear from the other reservations, and like you said, Kathy, it is here. You know, and I think for like our substance use program, as well as our mental health program, those are areas, you know, that we've been trying to work on, is the stigma that comes with that. You know, and like naloxone, because it comes in the nasal, and then also like I have a bag, you know, but it's got the syringes in it. There's the, you know, the directions come with it to how to use it. You know, there's like a face shield in case you have to resuscitate somebody, but it has, you know, the vials in it. But we've been getting the nasal spray, which currently we're out of. But like, you know, the other thing is we have through the HRSA grant and Laura and the College of Pharmacy students, where we did the swag bags and stuff. That include the Narcan, includes the strips for testing fentanyl. There's there's encouraging words in there. So there's multiple things in the swag bags and stuff. But I do really think that this is something that we need here at Boys Fort. You know, because the word gets out. So yeah, it's just, I think it will just overall help our community.
Mhm. I'd like to, I'm sure that sounds like we're in support of the machines. And maybe I'm not sure how we do this, but to sit down and figure out what's going to be put in the machines. I would like to see some suicide prevention things in there as well. Because with mental health month, even something with mental health, because each tribe is unique and each community has its own issues. And so I think that if we could get the vending machines and then figure out what's best for each community, but hit the things that are hitting us hard. So I think it's a great idea.
I think to branch off what Kathy was talking about too is to maybe have a community discussion, letting them know that what we want to put in these machines is that we're not trying to promote drug use. We're trying to promote safety and do it in a safe manner. Then if something should happen, we're trying to prevent something from happening. Something along that line.
Trying to prevent a death.
In response to that, I think we could, from this consortium, post some sort of forums on maybe both sides of the reservation and share information and get, listening session, get feedback from people before we actually purchase the contents of the machine.
Well, I know that we have discussed about, because, COVID really put a hamper on everything.
Yeah.
And we've been talking about trying to, it just seems like once we have a low curve of COVID, it starts creeping up again. But having community meetings with regards to the drug epidemic that we have here, and having some of our local people talk about their sobriety, talk about how tough it was. We've got a lot of people that have sobered up from meth and heroin and are on sober squads, and this would be a good in-way to that too.
Yeah.
Is to have that, and then I no offense here, but food brings everybody. We love to eat as Native people, as people. So I think that's something that we could plan to do, because and I realize we need to be safe with COVID, but we also kind of need to get back to dealing with some of the things that we need to deal with on a community level in some way. So, Pammy, if we could coordinate that.
Yep, I can. And there is the HOWA group, and a lot of people don't understand how they came up with the HOWA, but what it is, it's helping others with addiction and healing. So that's why I call it the HOWA group.
Nice.
They are planning a smudge walk and different things like that upcoming. So
okay. Is there any way, Pammy, that we can help support them and get their word out?
Yep. Actually, there I had some correspondence with Laura Palombi and then Dane that works out of Melissa's office, and there was it's a small grant, but it's for recovery, and so that was something, one of the questions Laura had asked, would that be something, how we could support HOWA? But yeah, and I know that the young lady that kind of spearheaded HOWA, she knows that her and actually one of them is on our CRC, so they have some good ideas. They have some good ideas of speakers. So yeah, they reach out, and that's, I know when we had talked about that, I don't know, a few weeks ago, about doing some community events.
Good.
So yeah.
Good. Sounds good. I'm excited. We do have the resolution here, and it says that whereas the Bois Forte Reservation Tribal Council has worked with Doctors Melissa Walls and Laura Palombi on previous opioid projects and grants in the past, and whereas the Bois Forte Reservation Tribal Council supports the implementation of public health vending machines proposed by Doctors Walls and Palombi, and now therefore be it resolved that the Bois Forte Reservation Tribal Council hereby authorizes Dr. Walls and Palombi to implement public health vending machines. This project involves seeking funding to stock and staff vending machines with public health items to improve the health and well-being of Bois Forte community members. I'm sure, and help me out here, Pam and Dr. Walls, but I think that our clinic could also supply some of those supplies for that machine, or is it special supplies that they need because they're packaged? It's like you mentioned the COVID test kits, for example.
I know Sean knows that there's some sort of, you know how when you get your candy bar and it gets stuck,
Yep.
you have to make sure that we don't do that, but we can
Okay.
work with the packaging to make sure that doesn't happen.
Yeah,
Okay.
I will say there is thorough testing with the machines before you just launch it to make sure that it doesn't just jam up.
Okay.
And even thinking through like what size box you put things in or what plastic it's, there's a process there.
Okay. Okay.
John?
John, Pam's talking. Ask, go ahead.
Oh,
So can you hear me?
yeah, sorry, I had an internet lag.
Oh, that's okay. Are you okay with talking about coming up this way, or is that something you don't want to talk about, or?
So for the Sidebar project, I will be in town in June, and I would love to hear from anyone who is willing to have a conversation with me about where we might recruit potentially people who use drugs for our project. And I will make myself available anytime anyone is available. I will try my best to make it happen. But I'm very excited to finally come visit after 2 years of COVID. I think it's going to be very informative because it's, as an outsider, I just don't know the context at all. And Pam and Melissa have been very forthcoming with information, but there's nothing like seeing it in person. So very exciting.
Wonderful. We'd love to have you, Sean. That sounds great. Great. Wonderful. Do we have any other comments for Sean or Dr. Walls or Pam?
Just a quick question about, the products that are being putting in there. They don't have to purchase them, do they?
No.
No. So the machines can be programmed where some things are free, other things are for purchase, but in general, things would all be free in a public health vending machine.
Okay, thank you.
Okay. No other questions. Do we have a motion? Oh, there's Dave. He's messing with his computer, I think. Actually, that's Nikki, but Robbie's even got green on. Welcome back, Robbie. You had a fire call.
There is a question in the chat too.
Oh, is there? Okay.
I seen Dr. Walls had answered it.
Okay. Are you back with us, Dave?
Muted.
I don't know what happened, but I was trying to turn up my volume and on the computer, and I don't know what I could hear everybody, but I couldn't see nothing, or I couldn't talk or anything. So.
Okay, Dave.
But I just had one question
Go ahead.
on the vending machine itself. Is there any way we could put like a little sticker on there, a little 800 number, and on contact information if somebody wants to communicate or talk to somebody about any problems that they may be encountering, or a family member that they're concerned about and they want to talk about it. So
good idea, Dave.
I like that. I like that too. I mean, just another way to in prevention and
get services out there.
Keeping our loved ones safe, and because we care about our people, we care about our families, and care about our friends, and we want to do everything we can to keep them on this earth as long as we can, so we can enjoy their company, and we don't want to lose them to a drug or anything like that. I mean, that's just a monster that's in the woods waiting for something to happen and jump on you. So, but yeah, I really like this too. So
That's why I can't believe this hasn't gone off in like droves, because it's like, this is just a no-brainer. I mean, anyway, I'll get off my little pedestal.
and then maybe is there something that we could put in the next newspaper coming up, saying, hey, this is what we're this is what we're planning on, and throw a picture of it, and then is it going to be only credit card accessed, or can people use
They're free. Some
cash?
things are free,
they're
Dave.
free. Okay.
Depending on
Well,
what it is. Some things are free, whatever we decide to put in there, I guess.
okay. Oh, that's really gonna be nice. Better yet.
Okay. All right.
Just a reminder, if you do put anything in the newspaper for June, it's due by Friday.
Okay.
Thank you, Nikki. Do we have a motion to approve the resolution to implement these public health vending machines?
Move.
Moved by Shane, second by Dave. All in favor signify by saying aye.
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 Opposed, silent, motion carried. I am so excited. This is awesome.
And you have bragging rights, first in the state. So this
Yes.
is cool. Mm-hmm.
Yep.
Miigwech.
We want Boys Fort to lead, right?
Yes, I certainly do. I was worried White Earth was outpacing us, but here we go.
Nope.
And we'll get that newspaper thing. I'll get it rolling, Pam and Sean, and I'll send it to Laura, and we'll get it in by Friday.
Wonderful. Thank you guys so much. Miigwech.
Thank you, everyone.
Thank you.
Thanks.
Miigwech.
Hey, Pam can stay on. She has some agenda items. Okay, Rob, welcome back.
Thank you. Yeah, so we got Pam. She has two items. First is a grant contract agreement for housing trust fund operating subsidy.
Okay, go ahead, Pammy.
Yeah, so this is for, it's a continuation. It's the operating subsidy to Minnesota Housing for New Moon. We were one of 28 selected for the approval out of a total of just a little over $3 million. We were awarded $153,836, and that grant term will be from October 1st, 2022 through September 30th, 2024.
I see it's going to fund a tenant service coordinator.
Yes.
Okay. Wonderful. Any
That'll
questions?
be a part-time, because that's like 23,000. But
Yeah.
I think what we can do is some of the other grants that I just recently received were, there's
Your
some
dog.
staff in it. So we'll work it out, but yeah.
Okay. So it'll help support a position and then funding for making it full-time. Okay. Any questions for Pam?
Actually, just one thing before we move on to approve this is getting back to the Melissa Walls and Sean Allen thing there with the vending machines, is that KBFT has always wanted to is always open to doing PSAs for like safety and education. So I think that it would be a good idea to get in touch with them.
Good idea.
Thank you.
Okay. Thanks, Jane. We have a motion to approve the grant contract agreement with the Minnesota Housing Finance Agency for the Housing Trust Fund operating subsidy in the amount of $153,836.
Move.
Moved by Travis. Is there a second?
Second.
Second by Dave. All in favor signify by saying aye.
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 Opposed, silent, motion carried. Okay, Pam.
Can I just address one thing while we're on that?
Yes.
For New Moon. I'm just gonna let you all know, we have an individual that has been creating problems over there. We've had police there 2 times within 1 week. So, I just want you all to be aware of that, and that I know there have been complaints made. And we are trying to deal with them the best that we can.
Okay, thank you, Pam.
Yep. So the next contract is also through Minnesota Housing, and this one is for COVID-19 emergency rental assistance housing stability service funding. So on this one, we were one of 23, representing a little over $5 million. Boys Fort, we did receive the full amount that we asked for, which was $188,502. That is from June 15th, 2022 through June 30th, 2023. These funds are only for supportive services. There is no direct services. So the direct services would be rent, deposits, gift cards, stuff like that. None of that will come out of this grant. But we will be able to hire 2 full-time staff. One will be a housing navigator, which we could also, I think we could work with Boys Fort Housing on that, on individuals that are coming in homeless and stuff.
Okay.
So we'll have an individual that can kind of navigate through the whole system.
Oh, that'll
And
be
the
good.
other one is going to be like a case manager for preventing homelessness.
Oh, nice.
Yeah,
So these will be new positions.
those will be new positions. And I know we were just awarded, I just received notice of another award that we received. And that one, we're going to be able to hire another full-time housing resource person. And then it will also kind of pay a small portion of my wages, but yeah.
Okay.
But yeah, so
Nice.
this one, the one that I'm asking for approval now will be for 2 new positions.
Okay.
Hey,
Pam.
Pam,
Oh,
I
go
had
ahead,
a
Dave.
question too. Do those people do they have to be trained, or will they be trained, or?
Yes, the one for sure will. There's training that they have to take through TrainLink with DHS. But as trainings are starting to kind of open up, but there are numerous trainings, Dave, that our staff can attend through CSH. And right now I have one of my staff doing that, and everything is online. So yes, they will be trained.
Oh, okay.
Pam, my question is this going to be ongoing funding? Like once this ends in 2023, can you apply again?
Well, on this one, they haven't said because
Okay.
it's COVID related.
Okay.
So I'm sure somewhere during this grant period, we will hear, but
Okay.
both of these positions will be able to bill for those services.
Oh, nice.
Yeah.
Okay, wonderful. Okay. All right. Any other questions for Pam?
Yes, with the new staff coming on board now, do we have enough office space over there at New Moon, or where they're gonna be placed at?
At New Moon, these 2 staff will have in Net Lake because we have 2 offices in Net Lake. And so that's where they're going to be housed. They will come over probably, 1 or 2 days or as needed. But it will also be where they'll be traveling into Virginia and, around
Okay.
the area providing services. So it's not going to be when they're in the office all the time. They're going to be out doing services.
So it's on and off reservation, Pammy?
Yep.
That's
Okay.
even better.
Thank you.
Okay.
Well,
do we have-
then one more question. How soon can we advertise for the position?
Well, I am hoping to do that once this is approved,
Okay.
that I'll get going and send it to Lynette so we can start the whole process.
Wonderful.
And my hope is, you guys, with one of these positions at the new shelter that we'll be having, that one of these individuals for sure will be staffed at the new shelter, because they will be able to do a lot of because the shelter will have like transitional housing. And so this individual will be able to help with a lot of that.
Pam, do you want to mention your shelter?
Oh, sure. Where's that file? There are too many new grants coming to you guys.
I know, but that's okay. But Pam, when the RTC building was built, for those of us that lived on the reservation here, we had to relocate Ruth Isham's home. And that was put out at Palmquist, and it's been out there for about 12 years now. And Pam has written a grant to fix that home for a homeless shelter. So Pam?
Okay, so we did receive a grant through DHS OEO, Office of Economic Opportunity, and it is to, I'm really excited about this. So, currently we have shelter programs for homeless people where we do hotel vouchers.
Yep.
This will eliminate that, where we will have our own shelter to shelter people, which to me makes better sense, because there will be staff 24 hours in the facility. As you all are aware of, some of the times when we end up sheltering people, I'll just give you an example of a recent one. We had to replace the mattress in the box spring in the room. We've had where we've had to, like I had said before, replace TVs, door fobs, extra cleaning because of, things, the condition of the rooms. And so this way there will be staff 24 hours a day that will be working with them, on case plans and getting them into housing, different things like that. So, and like for me, this is something really new, because I've never been involved in a construction project. And so I will be involved in that. And this will go out on RFP to, for someone to renovate the house and the renovating part, there's going to be a full basement put on underneath it. We're going to have a garage on it. The yard is going to be fenced. So it's, I don't know, I'm excited about it. So, yeah. And with our existing shelter funds, one, we have a shelter fund, and that's for off reservation. And then the one that we currently use at Fortune Bay, my hope is that those dollars can be used in the once we get the shelter opened up. So, and then I did find out too that we will be able to bill for housing stabilization while individuals are in the shelter. So there will be some revenue coming in. And those are other aspects that I'm trying to look at too, is the staffing of it, and then the being able to bill for different services. So
great job, Pammy. I just wanted to put a plug out there for that shelter, because this emergency rental assistance housing navigator, the homelessness, it all kind of ties together. So, all right. Next, do we have a motion to approve the grant contract agreement for the COVID-19 Emergency Rental Assistance Housing Stability Services?
Move.
Moved by David. Is there a second?
Second.
Second by Shane. All in favor signify by saying aye.
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 Opposed? Silent? Motion carried. Good job, Pammy.
thanks, everyone.
Have a good day.
Thanks,
You too.
Pam.
Good day. Thanks, Pam.
Thanks, Pam.
Mr. Hardy.
Yeah, next we got Mr. Peter Hardy with a Net Lake School update.
Oh, there I am.
There you are. Good morning.
Thank you for having me. I just thought it was appropriate at this time to give you an update on our wonderful elementary school. First of all, I did sign a contract to remain for 3 years.
Congratulations.
Thank you.
Congratulations.
I'll tell you, I had originally resigned, not that I wasn't happy, but with the price of gas and the travel up here was concerning. But what had happened is we only had one applicant and the person wasn't licensed. So I approached our personnel committee and said I would open up negotiations again, and successfully signed a 3-year contract. So I'm very happy to be back. It's the best place to me in Minnesota to work. And so we will continue on doing good things there.
Great.
So our enrollment next year should continue to be around 38 students. Obviously, always our enrollment is a concern, but we've got a large group of kindergarteners. Hopefully all will attend. There's about 5. So we're looking forward to that. And then we're only losing 2 6th graders that will go on to Northwoods. But we do get all that impact aid, and then we pay the tuition out for our 7th through 12th graders. So right now, the state of our budget is pretty healthy, despite losing the big group of seniors that are heading out. We've used some of our ESSER dollars to help offset and help our budget. I won't have a solid budget numbers until the next board meeting here in June. But at least for next year, things are looking pretty good. Good news, I don't know if you heard, but we had a terrible accident that started off as rain in December, turned into a slushy mess. Our sump pump failed back by our gym, between the gym doors and the Boys and Girls Club, and consequently flooded our floor. And no kidding, there must have been waves close to 2.5 feet tall once everything dried and swelled up.
Oh my goodness.
But that's why we have insurance. I would encourage you at any time, if you want to go see a look at our brand new floor. It is remarkable. And again, that's why we have insurance. But to fix that problem, I have our maintenance guy actually plumbing that sump pump out to outside. It originally had a garden hose sticking out of a window.
Oh, good Lord.
So we're going to try and make that permanent. And then I ordered these devices that will trigger our telephones should we have any sort of water source that's flowing up from that sump pump. My phone will go off, or my maintenance person's phone will go off, and hopefully that we can get there. And hopefully it doesn't happen, but at least it's a safeguard, so it doesn't happen again. Also, good news, we had a key fob system put in for safety. We used a grant that I wrote a couple COVID years ago, I guess. How long has it been? So it allowed us to put in a new key fob system, and also we're getting air conditioners in the classroom installed this summer. So we're really looking forward to that for our kids, because it gets so hot. You know, when you've been in that building, they have the aquarium type of roof, and all that hot air bleeds down and filters off into the classroom. So hopefully that'll provide them some relief. And then you probably know we're hosting that ADA class for people to come in and learn concrete, and we're going to have a new sidewalk installed, handicap accessible in front of the building. The Head Start, I think it goes all the way down to the entrance to the Boys and Girls Club. So, and looking at repairing some of the pillars. The pillars are literally deteriorating because of all the salt. So hopefully we can do something with that. I also contacted a gentleman to do a building energy audit to see if there's anything we can do to save. Primarily, the biggest cost out of our budget is people, human resources, which makes sense. But then secondary to that is the amount of energy we use in our building or buildings. So I look forward to meeting him and doing that energy audit. I also was in a meeting with a gentleman that talked about solar paneling and looking through solar paneling grants, and to see if there's anything out there that we would qualify for. Obviously, there's issues. Our HVAC is aging, our boilers are aging, and we're trying to keep up with that as best we can. It just seems like every day there's something else that ends its life and we have to replace. But we're dealing with that as well. And lastly, no, not well, I'll say this. The mosaic tile out front, I don't know if you've driven by the school lately, but the tile now is literally falling off. That beautiful mosaic. And I did have one gentleman come up and look at it. He hasn't sent me a quote. I don't even know if it could be replaced or if it all has to be chiseled off and replaced with something else. Because it's just adhered with mortar to the cinder block that's behind it. So I'll keep you posted on that. And then lastly, we are running a summer program through a grant that we received through our SR dollars. And Ryan Bajan's going to run that. We're pretty excited that we can run something like this. It's going to be primarily field trips, and we're going to run it for grades 4 through 6. And it looks like his notes say here, probably 3rd grade. And he's got items on here such as visiting the Gawboy farm, doing an elder service project, touring the Sudan mine, music camp, berry picking, lodging build or lodge building, ricing push poles, things like that. So we couldn't run our targeted service like we normally do because we don't have a cook at this point. Our cook went out in January. And so we've made do with a special ed teacher and our maintenance person cooking. And so consequently, we couldn't run a food program this summer. So this project or program that Ryan's going to do will fit in very nicely with what we're trying to achieve in getting our students out of the classroom and out there doing things, whatever, just other things rather than reading and math that they've done all year. And that's all I have, Madam Chair.
Yeah, Mr. Hardy and Robbie, I'm wondering, we're all having people problems with regards to positions and stuff, but I guess what I would like to ask the council and yourself, Mr. Hardy, maybe we could have quarterly meetings with you.
Oh, I'd love that.
Because I think that I think we can help, but by talking together is addressing some of the issues that you are running into that in some aspect, I think we need to be more creative in how to deal with things, with regards to our programs. And so if we can have quarterly meetings with the school, we are looking at solar. And I believe we have something on the federal level with our buildings. And I think we included the school, I'm not sure. But we are going to be looking at renewable energy quite a bit. We're also looking at, food sovereignty and all that kind of stuff. But even because you guys have been doing a great job up there with the kids. And I just want to commend you on that. And it seems like, yes, every time you turn around, there's something that I feel bad about your gym floor, but I'm glad you got a new one. But like the HVAC system, the boiler, the other thing COVID has done is, and we're not seeing it because we have a housing shortage. But a lot of people in the cities are moving up north. We had a meeting this winter with Commissioner Keith Nelson, and he said that there was like 1,500 additional septic system applications because people are moving up this way. They want out of the urban areas. So housing being an issue, you know, I know that's something we've been discussing as a council as a whole, even just for getting employees up here. You know, so I think that if we meet quarterly, that we can help address some issues that we could work collaboratively on. So
I would like that very much.
okay,
Yep.
sounds good. And welcome. Thank you for being here for the next
Yep.
3 years.
Yeah, I appreciate
know,
it. It's a great place to be.
Wonderful. Any other things, council?
Yeah, I was gonna say, when he was talking about making push bowls for the students, you know, another thing probably be knocking sticks. But I think if you coordinated something with 1854, I know they probably would be willing to come up and supply some, you know, some wood to make knocking sticks. Because I know one of the girls there, she makes knocking sticks, and I've seen some of her work, and she does a really good job. And I know that they're probably willing to you know, help with the push poles. But then with the berry picking, we just approved a grant application for $10,000 for the Boys for Sovereignty group, and it's being applied for by Danny Parados and David, my son David Jr. But you know, when the berry picking stuff, I mean, maybe if you could coordinate something with that group, you know, because they wanted to teach about the food and the wild foods that are out there, and what you can do and how to pick them and how to preserve them and how to use them in your daily diets or whatever. But if we kind of coordinate stuff with each other, then we're not having different groups going out there at different times or whatever. We could kind of stretch our dollars, and the education here would probably be a lot more educational for our young ones. So,
Dave, if I could add something to that, not just with the kids, but even the berry picking with the elders and the kids, because we have a lot of elders that love berry picking, but they either don't go out or don't know where to. They know where to go. They have their secret patches, but I'm sure they'd love berry picking with the kids, because I know I've taken some elders out berry picking north of Cousin in my secret patch. And not just kidding. But you know, there's a lot of berries on the reservation, but getting the kids and the elders together would be a good resource too, and that would be Danielle Porter with our elders program.
I will pass this information on to Ryan.
Yep, that's great.
This is good stuff.
I'm waiting to berry pick. There hasn't been berries for 2 years.
Yeah, it's been
Having
dry.
withdrawals. But thank you, Mr. Hardy, and Rob will get those meetings set up. It would be nice to have a summer meeting for sure before school starts, so we can
Agreed.
get that started.
Thank you so much.
Scheduled.
Okay, wonderful. Thank you, Mr. Hardy.
Thank you. Have a good day.
You too.
Okay. Next, I believe Chris is stepping in for Deanna Drift. We have 1, 2, 3, 4, 5 lease and items to approve.
Hey, Rob.
Yep.
I'm sorry. In chat, up on top of the thing there, where you hit the thing and it comes up and says more, and then you hit chat.
Okay.
There was some questions in there and a couple different things that someone had posted. That's what I was.
Okay, we can.
That's what I was
like
referring to. Sorry.
Hi, Dee Dee.
Oh, hey, Dee.
Hi, good morning. So I don't know if Chris is on. I know he had planned to be my backup if I wasn't going to be here, but I'm here.
Okay.
Okay, so first we have the cancellation of residential lease for Denise, Phyllis, and Robert. And then along with that will be the reissuance of a lease for Denise and her daughter Danny.
Okay.
But I know you have to go one at a time, so.
Okay. Okay, do we have a motion to approve Resolution 102, 2022, cancellation of residential lease for Denise Paradas, Phyllis, and Robert Boger?
Move. Second.
Okay, was that Travis?
Yeah.
second by Dave. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried.
Is that really Travis?
Yes.
Okay, oops.
Okay. And next we have the issuance of a residential lease for Denise Paratus and Danielle Paratus. Resolution 103, 2022. Holy crap. Do we have a motion to approve the residential lease?
Move.
Oh, come on.
Second.
Moved by Dave, seconded by Chief. All in favor signify by saying aye.
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 Opposed, silent, motion carried. Okay.
Okay, we have, next we have the modification of residential lease for Doris Isham and Billy Isham. That would be removing Doris.
Okay. Do we have a motion to approve the modification of the residential lease for Doris and Billy Isham?
Move.
Second.
Moved by Chief, second by Dave. All in favor signify by saying aye.
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 Opposed, silent, motion carried. Okay, Dee Dee.
Okay, and next we have our very first Cedar Grove 2, Phase 2 development lease. And it is for Lawrence Connor Jr. And it is a MCT residential lease. For
Okay.
now, he may modify it later, but
Okay.
I talked to him this morning. He wants this to go through today.
Okay. Do we have a motion to approve resolution 105, 2022, issuance of residential lease for Lawrence Connor Jr.?
Move.
Moved by Dave. Is there a second?
Second.
Second by Shane. All in favor signify by saying aye.
Aye.
Aye. I had a
Oh.
quick question.
Oh. Go ahead.
Does Lawrence have any other leases with us?
He has a recreational lease at Indian Point.
Oh, okay.
I had a question on that too. With that, is that one of the properties on Tibbetts Trail? This lease?
Jack Pine Way and Tibbetts Trail, they all kind of blend together. But yes, it's the new Cedar Grove development.
We're all along the lake properties, or is it inside?
Correct, along the lake shore.
All right.
Oops.
Well, did we get that straightened out? My question would be.
Oh, all of the boundary survey for all of those lots. Yes, they were 25 feet off, but they've been corrected.
Okay.
Thanks, Dee Dee.
Thank you.
Okay, now we have another item.
So this one was a request from Woodlands National Bank. They asked us to move the HUD 184 lease up for approval. And then they also had some language they wanted added. So we've been, Jeff and I have been working with them for a few months. And it's approved. Finally, just the final step is your approval.
Wow, that's good. That took a while.
Yeah, I think since last September, if I remember correctly.
Okay, cool. Do we have a motion to approve adding language to successor and interest clause number 13 in regards to the HUD 184 leases? Moved by Dave. Is there a second?
Second.
Second by Travis. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Good job, Dee Dee.
Thank you. And that's it for me.
Okay, have a good day.
Yeah, you too. Giga Wabaman.
Giga Wabaman.
I did. Oh,
Okay, Rob.
Sorry about that. I muted. So next we'll have Christine Lundemo with the 22-23 Net Lake and Vermilion Head Start childcare license renewal.
Hey, Christine. Oh, there you are. Hi.
Hi. Okay, our Vermilion and Net Lake Center license needs to be approved again for the 2022-2023 school year. And you have lots of paperwork there. We've got our Indian Health Service inspections of both centers. And then we have a health and safety checklist that's filled out between our nurse and safety person, Laura Furwalt, with a parent from each center.
Okay.
Any of the findings that we have from IHS, we work with the Vermilion Maintenance and works with our janitor, Bob Amatrero. Yeah, to fix stuff over there.
Okay.
And then we work with the school, since we're under a lease agreement with them, to fix stuff that's wrong at our Net Lake Center. So,
boy, and I know those IHS ones can be really picky, but that's okay. I mean, some of it is just minimal things that need to be fixed. So,
yeah.
Okay. Any questions for Christine on the Head Start Vermilion, Net Lake, and childcare license for 2022-2023? If not, I'll call for a motion to approve that license.
Move.
Moved by Chief. Is there a second?
Second.
Second by Dave.
Oh, you guys.
Favor signify by saying aye.
Aye.
Oh, silent. Motion carried. Thank you, Christine.
You're welcome. Could I say a couple things real quick?
Yeah, go ahead.
Well, when Peter was talking about the enrollment, we have a big 4-year-old classroom going into kindergarten in Net Lake. 8 out of 9 of our kids are going to go in this fall.
Nice.
So that's a nice group for the school.
Yeah, it is.
And we're also going to be, I'm going to put an article in the paper. So
Okay.
Nikki, thanks for the reminder that I got till tomorrow. But we are having a Net Lake Summer Enrichment Program up in Net Lake.
Oh, wonderful.
So it'll be for our 3 and 4-year-olds that can come all day, Monday through Thursday, 7:50 to 4:40. And so we're gonna use that time to just keep them going with their learning throughout the summer.
Oh,
And
that's nice.
so we're using some of our COVID money to pay for the 2 teachers, which is Ashley Puller and Stephanie Wordier.
Okay.
So they're very excited to offer that. And I know it's going to be a big help to our families with childcare.
Wonderful. Thank you, Christine. That's awesome.
Yeah. Just wanted to let you know.
Good job. Keep up the good work up there, Head Start.
Thank you very much.
Very much appreciated.
You're welcome.
Bye.
Miigwech.
Okay, next up is me, I guess. First on there will be the micro purchases. Basically what it does is move our sole source from 7,500 up to 10,000. I do believe Jeff had a resolution ready for it, so.
Yep, that'll be resolution number 108, 2022.
Okay. The procurement policy that we recently adopted has the micro purchases at 7,500. We've had a couple of our directors say that it's really difficult to get some items or get 3 bids on some items or even a response on 3 bids for some purchases. And Jeff, the IRS ruling is 10,000. Correct?
Yeah,
Okay.
Yep, the federal regs allow up to 10,000 for micro purchases. And just so everyone's aware, like what that basically means is micro purchase is a form of non-competitive procurement, meaning you don't have to go out and get free quotes. You don't go out and do an RFP. You don't do sealed bids. You can go to a single vendor for the equipment or services, as long as there's a conclusion that basically the price is reasonable.
Okay. Any questions,
I had
council?
a
We will
question.
have to change the procurement policy to this.
I had a question on that. Say for example, you put out an RFP and you get one bid, say from Shane Shoddy, sheet work medic, whatever, Shane Shoddy work. Okay, well, he comes back at say 11.5. Okay, and he and there's no other bids. You know, no one wants to do the job but Shane. So, okay. So can you accept that bid, or does it have to keep going until you get 3 bids?
No, if you do an RFP, like a request for proposal or a sealed bidding process, competitive procurement, and you don't get a number of bids or RFP proposals, you just get one, for example. As long as the band has made, a good effort to try to publicize and get as many bids as possible, you can still proceed with a single bid. You just have to show that, you attempted to procure it competitively, but couldn't do it. So it doesn't mean that you're strapped and can't do the process. You can still move forward in that situation.
Kind of like what Joel did earlier today.
Yeah.
Would you listen to
Right.
Joel? He put it out for bids and he only got one bid in, but it sat in that parameter where it was competitive and it wasn't way over what he wanted.
Yep.
So he was asking for us to accept that. He said he was happy with it.
Yeah.
So that's what we did.
Right. So to that point, what Travis said, yeah, I mean, that the caveat would be you don't have to accept the bid if it's outrageous, right? So if you only get one, you can still, you still have to determine it's reasonable, that the band's willing to pay whatever the proposal was, but you don't have to go out and get more bids and do more work. You can still move forward with that single bidder if it's a reasonable proposal.
All right. So say, for example, we're putting out that work for the DNR elderly units for the prep work for the getting the sites ready so they're ready to go. And we have one bid. You can accept that?
Yes.
Okay.
If we want to.
As long as
If
it's
there's only one bid.
Right. And if you were to get one bid and say, no, we don't want to go for a variety of reasons, maybe it's price, maybe it's other reasons, we don't want to go with this vendor, you could reissue, right? You could go more broadly, or you could try to do that if you wanted to, but you wouldn't have to. It's kind of the council's discretion to move forward with that bid if it's reasonable or not.
All right. Thanks, Jeff. The reason I'm throwing these questions and stuff out there is because with all this COVID infrastructure money out there right now, the companies that do this stuff are going to be busy.
Yeah.
That's what I'm saying, is the companies that are doing this is going to be busy. Companies that construct, that build buildings, that do construction, we're going to have a tough time finding people to actually do this stuff because there's going to be City of Virginia, City of Orr, City of Embarrass, because they're all eligible for these monies. And there's going to be a lot of infrastructure stuff going on. And that's why I'm saying it. There's going to be a shortage of workers, which there already is. So I was just putting that out there that maybe we can look at,
Okay.
I'm good.
Okay.
Yep.
Any other questions on the procurement? Raising the micro purchases up to 10,000?
For the record, it's not Shane Shoddy's works, it's Shane's top quality work.
Okay, all right. Do we have a motion to approve resolution 108, 2022 to raise the micro purchases from 7,500 to 10,000.
Move.
Motion made by Chief. Is there a second?
Second.
Second by Shane. All in favor signify by saying aye.
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 Opposed, silent, motion carried. Okay,
And then I'll turn it over to you.
okay. Next on the agenda, I asked Rob if he could add this, but just to make everybody aware that because of the water issues, rising of the waters here, the Net River Dam is in dire need of getting replaced or fixed or whatever. We know we've known that. But because of the high water that we have now, the berm is gone. And Robbie and Travis Morrison and some others went out yesterday. We really need to, and I'm just going to put this out there that we really need to have a declaration of emergency for our Net River Dam. The reason I'm saying that is because it's detrimental. The dam is detrimental to our lifestyle. It's detrimental to our wild rice, and it's an emergency that we're in. And so in order to obtain some type of emergency funding or federal funding or something, I really think we need to declare officially a state of emergency for the dam. That way it's documented, and we know, we have a specific date. This has been one of the things that I think that we didn't anticipate. You can't anticipate Mother Nature and the rain and whatever, but considering last year was a drought, now this year the water levels are tremendously high, that we couldn't anticipate this. But just to get that date documented, and it is an emergency situation for us here at Boys Fort. It's going to affect our rice crop if we don't do something right away. We are in the process of doing some band-aiding. We've contacted our lobbyists and our state legislators regarding that. Chris Holm is working with Damon Day with our FEMA, possibly. We're trying to utilize as much resources and emergency things out there that we can, but we need to declare this a state of emergency.
So I'll move to declare.
Okay. Motion by Shane. Is there a second?
Second.
Second by Dave. All in favor signify by saying aye.
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 Opposed, silent, motion carried.
Kath, did you see that email from Kim about St. Louis County Board issued a state of emergency and county due to the flooding is, and then I'm sure that Cooch County is also probably, might be, I don't know if they are or not.
Oh yeah, that's a good idea, Dave.
But maybe if we could have Joel look into, or somebody look into, see if we could be included in that, because Cooch County, I mean, the dam would fall under Cooch County, and if there's ways we can recover get some money or get some help or something for that. So
I mean,
we're gonna have to do whatever it takes. And it may. Oh, Joel's got his hand up. I'm sorry, Mr. Astleford.
Yeah, I just got off the phone with Coochiching County. I directed them to dock St. Louis County Sheriff is aware of it. FEMA up there is aware of it, and all the roads department up there is aware of it. So,
okay, thank you, sir.
Yep.
But yeah, and whatever we need to do, we're going to have to incur costs to get it done. So,
ain't part of the lake in St. Louis County too, though?
Yeah.
So
we've contacted St. Louis too.
Yeah, we can utilize their statement too to help us back it, couldn't we?
Yeah. Oh yeah. Yep.
is there any way that we can get any federal funding too, or would that be a possibility? Or
that would be under FEMA, I think.
Okay, okay,
So,
okay.
but I have made our lobbyists aware of it, so Reed will make sure that it needs to go, because I sent him pictures yesterday.
That was my question, but where's Reed with?
Yeah, he's aware of it.
Okay,
He was
thank you.
talking with Senator Bob yesterday.
Chris just noted in the chat that he was in contact and he's got a meeting with them soon. So it sounds like that's in the works, and it might be helpful. And I can talk to Chris about this too. For any of those coordinations with FEMA or federal money, the declaration that you as council just voted on, it might be helpful to get that in a resolution, so we have something in writing we can send on to the state of emergency.
Okay.
The pictures that were taken yesterday, were they did they use a drone or anything, or did they just take pictures? You know, somebody taking the pictures themselves, or should we
They
get
had one out
pictures
there, but I don't know
too?
if they were taking video or anything.
Okay,
Yeah,
is there
they-
any way that we could utilize a drone or something to?
They
take
had it
some
out there.
pictures?
Yeah, the doc just said in the chat there that the drone pics were taken. They did have their drone flying yesterday.
Oh, okay, okay, okay. Geez, I wish I knew you guys were going out there to come with you.
You were sleeping, Dave.
No, he wasn't. No, he wasn't.
Okay.
That was that.
It was
that
just
really,
a rush thing.
Yeah, it really happened fast. Like I just got a text and like out the door we went, almost like a call.
Okay.
So
Yeah,
you
'cause
were
I
on
know
Indian time.
Oh, I was gonna take a ride out there yesterday, but then end up just got caught here at the office and I just couldn't get away there for a while. And so,
Okay. All right. So we'll get that moving. Do we have a motion to adjourn?
is there something on this other thing?
Wait, no.
Is there this thing, quick deed thing too, or what is it?
That's in executive.
Oh, okay, okay.
Yep.
Okay.
Nikki, you have a question?
Yep. If you're gonna do a resolution for the declaration, do we just want to sign that right now?
Assign the number?
Yeah.
Yeah.
Okay. That'll be 109/2022 then.
Okay.
There
And
is
we'll
executive.
let's do a motion to approve that resolution. 109/2022 for the declaration on the dam.
Move.
Moved by Chief, seconded by Shane. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. There.
Are we getting executive later today?
Yes,
I don't got a package.
it's on there.
I just sent them to you when I was talking to you earlier.
Oh, you did? Okay, I'll look. Sorry.
Okay, do we have a motion to adjourn?
Move.
Oh my God, they all said it. Moved by Shane. Is there a second? Come on.
Second then.
Second by Dave. All in favor signify by saying aye.
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 Opposed, silent.
Opposed.
Oh,
Kidding.
motion carried. Everybody, enjoy the weather, even though it might be raining, but at least it's not snowing. The lakes are open. Enjoy your families. Be safe. COVID is still out there. And keep in touch and look forward to seeing you or having you all attend our next meeting. Giga Wabaman.
Giba Wabaman.
Giga Waterman.
Dave Morrison signing off.